So for an alginate impression, you need trays. These are the types of trays that your office can have. So this set, if you can come closer, this set is by colors. So this will be a large tray and it'll be the purple. So how to identify a maxillary tray from a mandibular tray. A maxillary tray will have this section in the middle that is for the palate. The mandibular tray doesn't have that palate and it has the space where the tongue lies. So you will identify this will be a mandibular tray without a palate. This will be a maxillary tray because it has that palate. So this is the large, this would be the medium, and this would be the small, and they go by colors. Then there could be another system that it goes by numbers. So it goes, the largest trays are going to have the lower number. So 1 and 2 is the large one. It has the same color, but 1 would be the maxillary tray that has the palate, and 2 would be the mandibular tray that has the space for the tongue. The medium tray will be number 3, if you can see that, and number 4. 3 and 4, maxillary, mandibular, or 5 and 6 for maxillary and mandibular. So this will be large, medium, and small. So as you can see, it's kind of like one size fits all kind of thing. So aside from this, you're going to try it on the patient. So if this doesn't fit well on a patient, you might want to use something called utility wax or rope wax, and it looks sort of like this. Okay, so how will we use it? Let's say that when you try it on the patient, it doesn't fit and covers the whole teeth. So if we want to make this tray a little bit higher, then we can add this wax around it like so. If you can see here, you can go around it in the areas that you want to make it higher, if that's what you want to do. Or let's say if you want it to make it longer. Let's say that this is a great fit on the sides or on the height, but it's not covering all of the teeth. Maybe she has, or the patient has, 4 molars instead of 3, or whatever it may be. So you will add it on the back and you will make this a little bit longer. And this is how you would do it with the utility wax. Okay, so you will go like this, and you want to make sure that it stays on the tray and you kind of like build onto it. Okay, another thing that you can do is you can have trays that are disposable, because these over here are autoclavable. But you can have these disposable trays that you can throw out after each use, and you can heat them up, melt them, and kind of open them up with the heat, kind of bend them, and that would be another way for you to make sure that it fits and covers all the teeth to get a good mold out of that patient's mouth. Okay, so that's with the trays. After the trays, aside from the tray, you need to have a mixing bowl and a spatula. Mixing bowl and a spatula, right? And then you're gonna have the alginate. This is the alginate powder, and it comes with a mixing cup. So you're gonna have in your office a lot of alginates. Each alginate, each manufacturer has their own components, chemical components in their alginate. So depending on their chemical component is the amount of water that you have to place on that powder. So every manufacturer has to come or bring a specific measuring cup and a specific scoop for that powder. So some powders are going to come just in a bag and is not going to come with a measuring cup or a scoop. You have to make sure that if it's not the right scoop or measuring cup, it's going to give you a wrong mixture. For example, I'm going to show you. This is a different measuring cup than this one. This one is for the brand, for this brand. I'm not going to say it, but it's there. And this one is for another specific brand. And it came with this scoop. Now we're going to compare it with another scoop. You see the difference here? One is smaller and the other one is a lot bigger. So you have to make sure that the one that you're using is for the specific alginate that you have. If not, what a lot of assistants do, they just eyeball the powder and water mixture to the consistency that they know that it's supposed to have. That's what you have when you have more experience. But you are supposed to have the specific scoop with the specific measuring cup when you're using the alginate. Okay, so these are the things that you should have when you are taking an alginate impression. Another thing aside from this that sometimes is used is an adhesive. So you would place paint on an adhesive onto the tray. So when you put on the alginate material, when you put it inside the patient's mouth, when you're trying to take it out, it doesn't come out of the tray. So that's another thing that you can do, but just, be gentle, be careful when you're taking it out, so it doesn't come out of the tray when you are suctioning it out of the mouth, because it's actually like it suctions into their teeth. So these are the things that you need to have to do an alginate impression.